Okay, so now first starting with our main type of cancer, that is ductal carcinoma in situ. As the name says, ductal carcinoma in situ, it is the proliferation of tumor cells inside the ducts without invasion of basement membrane. So you're not going to see any mass in this. On mammography, you're going to see calcifications. On mammography, you're only going to see calcifications. But these calcifications, they do not suggest a malignancy, right? So, because calcifications are also seen in benign conditions. When we will be talking about the inflammatory conditions, in inflammatory conditions like sclerosing adenosis and in fat necrosis, you're also going to see calcification. It does not suggest you a malignancy, right? These are the benign conditions. So to differentiate this calcification, whether these are the calcifications of benign origin or malignant origin, we are going to do a biopsy. In biopsy, we are going to differentiate malignant and benign conditions. So in mammography, just because you're doing mammography does not tells you that it is a malignant type. So you are going to do a biopsy. Tumor cells, they form different pattern inside the ducts. They form different patterns. First type is solid pattern. In solid pattern, what you're going to see is that there is a duct, and inside the duct you're going to see the tumor cells. They are uniformly arranged. Tumor cells arranged in a uniform pattern. This pattern is called solid pattern. Another pattern, which is called comedo pattern. In this pattern, we are going to see a duct in which tumor cells are present. But centrally a necrotic debris is present. Centrally, you're not going to see any tumor cells. Necrotic debris is going to be there. So this is another pattern. Third type of pattern is called papillary pattern. In papillary pattern, you're going to see this is a duct. Tumor cells, they're going to form finger-like projections. Tumor cells, they form tumor-like projections. This pattern is called papillary projections. So inside the ducts, tumor cells can form various patterns. Now there's another disease called Paget's disease. What is Paget's disease? In Paget's disease, these are also tumor cells inside the ducts. But when these tumor cells sometimes these tumor cells they extend up the ducts to involve the skin of the nipple. When these tumor cells that were present inside the duct extend up the duct to involve the skin of nipple, this disease is called Paget's disease. In this disease, the nipple is ulcerated. Nipple is ulcerated, and Paget's disease always suggests underlying carcinoma. Always suggests underlying carcinoma. Right? So now moving towards next type of carcinoma, and that is invasive ductal carcinoma. In invasive ductal carcinoma, what you are going to see, the tumor cells, they invade the basement membrane. They invade the basement membrane and infiltrate the stromal cells. As these tumor cells they are coming out of the ducts, they are going to invade, they are going to infiltrate the stromal cells. So they are going to make a mass. So if the mass is size is more than or equal to 2 centimeter, then you can detect it clinically. But if the mass size is more than or equal to 1 centimeter, then it can only be detected by mammography. Another point is that invasive ductal carcinoma, it is the most common carcinoma. It is the most common carcinoma. Almost 80% of the cases are of invasive ductal carcinoma. If you do the biopsy of these invasive ductal carcinoma tumor cells that are present in invasive ductal carcinoma, then you are going to see that the tumor cells they form duct-like structures. You are going to see that the tumor cells they are going to form duct-like structures. Okay, inside the stroma cells. These are the stroma cells, right? These are the stroma cells, and you're going to see, many duct-like structures that are formed by the tumor cells inside the stroma cells. These are the stroma cells, and these are duct-like structures formed by tumor cells. There are various types of invasive ductal carcinoma. Subtypes of invasive ductal carcinoma. First subtype is tubular carcinoma. What you are going to see in tubular carcinoma, you're not going to see myoepithelial cells. You're not going to see myoepithelial cells. What were myoepithelial cells? If you saw my previous video, there I taught you that the lobules and the ducts, if this is a duct, the lobules and the ducts, they are surrounded by two layers of epithelial cells. First layer that is present outside, and the second layer that is present inside. Layer that is present inside is called luminal layer, and the layer that is present outside is called myoepithelial layer. So in tubular carcinoma, what you are going to see, that there are duct-like structures, but they lack myoepithelial layer. Myoepithelial layer that was responsible to propel the milk forward, they are absent in these type of tumor cells, in these type of duct-like structures that are formed by the tumor cells. So this is what you are going to see in this particular subtype. The other subtype is mucinous carcinoma. In mucinous carcinoma, you are going to see tumor cells that are floating in the mucus. As the name says, mucinous, so these are the tumor cells that are floating in mucus. In which age group you are going to see these type of mucinous carcinoma? In which group you are going to see mucinous carcinoma? Mucinous carcinoma is usually seen in older females. It's most common in older females, and mucinous carcinoma has a good prognosis. Another subtype is medullary carcinoma. In medullary carcinoma, you're going to see tumor cells. You're going to see tumor cells that grow as sheets, and these tumor cells they are surrounded by lymphocytes and plasma cells. It means that our immune system is trying to fight these type of tumor cells. If our immune system is trying to fight these type of tumor cells, it means that this carcinoma will have a good prognosis. And remember one thing, that medullary carcinoma, it grows as a well circumscribed mass. So it mimics fibroadenoma. What is fibroadenoma? Fibroadenoma is a benign tumor. Oma means benign. It's a benign tumor. So medullary carcinoma tumor cells, they can mimic as fibroadenoma because they are well circumscribed like fibroadenoma, which is a benign tumor. So you can mistake it as fibroadenoma. So to distinguish fibroadenoma and medullary carcinoma, what you are going to do is you are going to do a biopsy. You are going to do a biopsy to differentiate between medullary carcinoma and the fibroadenoma, which is a benign tumor. Then there is another subtype that is known as inflammatory carcinoma. In inflammatory carcinoma, the tumor cells they proliferate in dermal lymphatics. It means the tumor cells, they are already present in the lymphatics, so they can spread in the body very rapidly. So they will have a poor prognosis because they are already present in the lymphatics. They're going to have a poor prognosis. Sometimes you can mistake this inflammatory carcinoma with acute mastitis. Acute mastitis is another inflammatory condition in which you see inflamed or swollen breast. So you can mistake it for acute mastitis. But what we do in acute mastitis is, acute mastitis, which is also known as lactational mastitis. If you diagnose acute mastitis or lactational mastitis, then you will be giving antibiotics because acute mastitis is due to a bacteria called Staphylococcus aureus. When a baby, acute mastitis is seen in breastfeeding female who feed their babies, and if accidentally there is rupture of the nipple, then the staphylococcus, which is present, which normally resides our skin, it penetrates the nipple, and inflammation of the ducts is seen. So you can mistake inflammatory carcinoma and acute mastitis. They look the same because in both of these conditions there is inflamed and swollen breast. So you will prescribe antibiotics to that mother, but you will not leave her like that. You will advise her to visit you after 5 to 10 days. If that female's condition, if it was acute mastitis, then it will be treated by the antibiotics. And if not treated by the antibiotics, by antibiotic, then it can be inflammatory carcinoma.